All right, we're going to start Unit 1, the Sexuality, Reproduction, Pharmacology lecture. Okay, this one's going to go pretty quick. There are a couple of different main types of birth control that are used. The first group that we're going to talk about are the oral contraceptives, or also called OCPs, as in oral contraceptive pills. They either act by preventing ovulation or by producing thick, viscous mucus that make it almost impossible for a fertilized egg to be implanted in the uterus. They have chemicals similar to the hormones estrogen and progesterone. There are two main types: the estrogen-progestin combination products. These are the most popular ones that you see on the market. And then there's progestin only containing products. Oops, sorry. Okay, so starting with the OCP. So here's going to be the ones that contain both of those. So these are the most commonly prescribed oral contraceptives. They suppress FSH, which is the follicle stimulating hormone, and LH, which is the luteinizing hormone. So it's going to stop ovulation. Truthfully, what it's doing is it makes the female body think that it's already pregnant. So that way it doesn't ovulate. There's changes in the endometrium that make it less favorable for implantation. The goal is to identify the product that offers the best contraceptive protection while producing the fewest unwanted side effects. There's three main types: monophasic, biphasics, and triphasics, meaning they're going to have either one phase to them, two phases to them, or three phases to them. The monophasics, these are going to be I would say the formerly most commonly prescribed, just in my own, experience. They provide a fixed ratio of estrogen and progestin throughout the entire pack of pills that are taken. Usually it's going to be like a pack of 4 weeks or 28 days, and it's going to have the same level in it for 3 weeks, and then 1 week of placebos. Sorry guys, I had to pause and it kind of screwed up my computer here. So then the second kind are the biphasics. These are going to have estrogen fixed amount during the whole pack of pills, and then the progesterone is going to vary. It's going to be decreased in the first half and increased in the second half. These are becoming more popular. They work better for people that may have some in-between spotting or some cramping, that kind of thing. Triphasics, these are the newest combination. These are what I see prescribed most often, that they're going to have a different level of progesterone, week 1 to week 2 to week 3. Orthotricycline is going to be, one of the most popular or most common prescribed birth control pills. And then there's the extended cycle oral contraceptives. These are going to be your ones that last for 3 months. So a female can go 3 months without having their cycle. And it's best for those who forget to take their pills. It's a 91-day regimen with 7 placebo pills. It has, and different types of those would be like the Lostrin, Yasmin, Yaz, there's and Seasonal, I think, is one of them out there. All kinds of different ones for those as well. People don't typically like the extended cycle ones because there are people that, if they don't get their period every month, then they worry about, are they pregnant, and that kind of thing. So, it's not for everybody, but if you're a person that doesn't want their period every month, then this might be a better solution for you. All right, the mini pill. So the mini pill, it acts primarily by altering the cervical mucus and acts secondarily by altering the endometrium. It decreases the circulatory side effects. It's not as effective as the other oral contraceptive pills. The mini pill, if taken more than 3 hours late, you need to use a backup birth control method, at least for the next 48 hours. So for the mini pill, there's no placebo pills either. It's just progesterone for 28 pills for a whole pack. And the purpose of these, or why they are on the market, they're not that common, they are expensive, is this is for your postpartum breastfeeding moms, that if they were to take the other kind of birth control, then it could dry up their breast milk supply. But so this is for breastfeeding moms that still want some contraceptive protection. There's a lot of breakthrough bleeding with these. They're just like I said, they're not as effective, and they are kind of expensive to purchase too for patients. So the purpose of having estrogen, just kind of going back with the oral contraceptive pills, with estrogen, estrogen is so that you do get a period. Okay, if you don't have estrogen in there, then you won't have a period. But with the mini pill, the amount of progesterone is so low in these that you could have that breakthrough bleeding quite frequently throughout the pack of pills. Okay, other alternative formats of birth control. Depo-Provera, which is an IM shot. It says IM, but I know that there is subcutaneous as well because I've probably given thousands of Depo shots over my career. Anyway, they provide a 3-month contraceptive protection. People that have these usually don't have any period at all. These are really helpful for people with, like Down syndrome or some other kind of mental type thing going on where, having a period could be scary or even traumatic for a person. So this allows that cycle to even stop altogether. I have seen this also given for males in order to suppress like sexual urges as well. And then something to consider though with this medication is that people need to take a break from it. It can become less effective over time and can really put a person at risk for early onset osteoporosis. There are also implants. The Implanon, this is one of the more common ones. This gets inserted under the skin, provides 3 years of contraceptive protection. I've known quite a few people personally that have had this done. You have to go to a specialist. You can't usually get this done with your family doctor. And because of the hormones and everything, it has driven people like crazy that they just are on a roller coaster of emotions, and it takes a while for them to like kind of figure themselves out. So just as a side note, and then you can have a lot of cramping and kind of breakthrough bleeding with those as well. Orthovera, this is the transdermal patch. I haven't seen this one prescribed all that much. It's a new patch every 7 days for the first 3 weeks, and then no patch on week 4. Okay, the next one is the NuvaRing. This one also needs to go to a specialist, an OBGYN, to be prescribed. The NuvaRing, I personally know about 4 people that have had this and have gotten pregnant on it. I need to do more research to see if, what the effectiveness of this medication is, but it is a 2-inch diameter ring containing estrogen and progesterone that is inserted right into the vagina. Mirena, this is an IUD. IUDs in and of themselves are a thing that is inserted into the uterus, and they make the environment unsuitable for an egg to implant on the sides. So you have kind of plain IUDs that don't have any medication to them that simply work by just irritating the environment. And then you have the Mirena. The Mirena is an IUD, so it irritates the environment as well as having hormones in there. So it does help kind of stop the flow of period. These do take a while to get used to. People don't feel them when they get inserted, but they do. They can have some increased like crampiness or vaginal discharge, that kind of thing. Emergency contraceptive, the Plan B pill, this is now available over the counter. This is for taking right after you have sexual intercourse. The earlier you take it, the more effective it's going to be. It has proven to be somewhat effective even 3 days after having sexual intercourse and preventing a pregnancy. Okay, hormone replacement therapy. So this is most of the time going to be estrogen. We do hear about some progesterone, especially, if somebody's having some difficulty, with sexual intercourse, progesterone has been proven to be effective in helping with that. So the use is to help to alleviate signs and symptoms of menopause, such as hot flashes or sweats, or even like, vaginal discomfort and things like that. Route can be PO, creams, injections, and patches. Side effects: nausea, vomiting, weight gain. And then I've also talked about, that cancer risk. Nursing implications: you need to notify the physician that vaginal bleeding that is undiagnosed, thrombophlebitis, or a history of CVA. Names: usually conjugated estrogens, Prempro, estradiol, something like that is going to be what they're called. Okay, estrogen blockers. I've already talked a little bit in my previous recordings about tamoxifen. Tamoxifen blocks estrogen receptor sites of cancer cells, therefore inhibiting tumor growth. These, again, are tumors that are driven by estrogen. These are going to be ineffective for tumors that are not driven by estrogen, which are mostly going to be your like genetic hereditary type tumors that are not going to be estrogen driven. So use prevention and treatment of breast cancer. They have been proven to be effective. Side effects: hot flashes, shortness of breath, weight gain, nausea, vomiting. Nursing implications: instruct the client to use barrier method of contraception while on this medication and for 1 month after. Monitor CBC, serum electrolytes, LFTs, which are liver function tests such as AST, ALT, and thyroid levels. May increase bone or tumor pain. Okay, antivirals. These are also going to be used, if we look at, herpes or something like that, or genital warts action. Antiviral agent inhibits viral cell replication. Used in the treatments of herpes virus route, you're going to take it PO or topical cream or ointment. These are all useful in cold sores that form on the lip. Abreva is kind of a really common over-the-counter one. Side effects: nausea, vomiting, headache, rash, or hives. Nursing implications: monitor kidney function. So kidney function, you think of serum creatinine and the BUN. That is it for a review of reproduction and sexuality pharmacology.